things that are prescribed that carry a very significant risk. And one of those risks can be fatal.
Trouble breathing, slow speech, sudden loss of consciousness, or tightness in the chest. Most people don't read side effects of the prescription drugs they are taking. And that was revealed in a recent study which used eye tracking tools to confirm it. Valley News Team's crime and safety reporter Nicole Johnson spoke with a local doctor who says most people are prescribed too many drugs in the first place.
Those little words on the side of the bottle, we know they're there, but oftentimes we think that side effect won't ever happen to me.
That's how we think, but the reality is that the third leading cause of death in the United States right now is iatrogenic, meaning doctor caused. That's alarming, and it's something we have to take very seriously.
Naturopathic Dr. Todd Ferguson says most doctors are trying to do the right thing when they give you drugs, but it's not always the right thing.
We still have to look at the hard reality that there's a lot of things that are prescribed that carry a very significant risk, and one of those risks can be fatal.
Dr. Ferguson says society as a whole is looking for a quick fix. People end up taking expensive drugs forever, drugs they don't actually need, or end up taking another drug to counteract the side effects of the original one.
What we've been told is this is how medicine works. You go in, you get a prescription for a medication, and if needed, if that doesn't work, you have surgery.
Patients are looking more closely at the data behind their medications, asking better questions of their physicians. What do I need to be aware of?
Sanford pharmacist Nathan Liedall says if anything good has come out of the opioid crisis sweeping the nation, is that people are paying more attention to possible harm of drugs they're taking.
No question is a bad question, and whenever in doubt, it's good peace of mind just to know what should I be concerned about and what isn't a big deal, and I think it's always better to ask in those situations.
Dr. Ferguson says there is a time and a place for prescription drugs, and they can do good, but at their clinic, they focus on the root cause and alternatives to medication.
The question is, how necessary is that? And that's a great conversation to have with your doctor.
And he adds, those little words on the side of the bottle are a bigger deal than they appear. Nicole Johnson, Valley News Live.
The pharmacist we spoke with says if you're taking more than one drug, you should always be keeping a list to show at the pharmacy. Mixing medications can be very dangerous, even if they are just over-the-counter drugs. Coming up after weather.